Welcome to Onslow County Today. I'm your host, Lisa Whitman-Grice, and today we are coming to you from the Onslow County Justice Complex and Onslow County Sheriff's Office. We have some very important information to share with you today. We're going to visit first with Denise Leyva from Onslow County Senior Services, and she will share with us about the upcoming Medicare Update Seminar. We'll also visit with the Honorable Omega Jarman from Onslow County Register of Deeds about some of the important services that they provide to our community. Next, we'll chat with Norman Bryson about Preparedness Month. Not just hurricane preparedness, but preparedness for all kinds of events and weather circumstances. We'll also chat with Danny Cook from Onslow County Animal Services about their Clear the Shelter event and a very special program they have coming up on September the 7th. Then we'll chat with Matt Mano from the Onslow County Health Department and talk about a very important topic, suicide prevention, and what that looks like here in Onslow County. We'll talk with Tori Parks from Onslow County Public Library about National Library Card Sign-Up Month and also all the programs going on this fall at our Onslow County Public Libraries. We'll also chat with Aisha Ford about childhood obesity prevention and what the Onslow County Health Department is doing to assist our families. And lastly, we'll talk with Veronica Ortiz from Consolidated Human Services and the Honorable Chris Thomas, Sheriff of Onslow County, about a partnership that they've entered into to provide substance use treatment here at the Onslow County Detention Center. As always, we are so glad that you are here for Onslow County Today, and we look forward to sharing this valuable information with you. Welcome back to Onslow County Today, and we're welcoming back Denise Leyva from Onslow County Senior Services. Denise, thanks for being here.
Thank you for having me.
Denise, your official title with Senior Services is Program Assistant, correct?
Yes, ma'am.
So explain to us a little bit about what that job entails, and then we're going to segue and talk about how you are coordinating this upcoming seminar.
Okay, we assist with all the programs that go on at Senior Center. All the good and fun activities, actually. We get them all together, the classes, along with all the events that go on at Senior Services.
And if anybody has ever been, and right now you're in your temporary location over on Richlands Highway there on 258 near the turnoff for the airport, but if anybody goes in there, there's always something going on.
There is. We're active bunch.
I mean, from aerobics to music to crafts to just fellowship, it's just a wonderful, the energy of your place and what you all do for our seniors is remarkable. So first, let me compliment you on that.
Thank you. Thank you.
But the other thing that you are so involved with is coordinating the SHIP program for those who receive Medicare. And the first thing we want to explain is, let's define what SHIP is, because we've heard about this program for many years, but it's an acronym and we want to explain to folks what that is.
SHIP stands for Senior Health Insurance Information Program. And what that does, that helps the seniors that when they get ready to turn 65, they go ahead and come in and make an appointment with myself or my volunteers. And we go ahead and help them and explain to them when they turn 65 what's available for them, the different programs and different steps that they have to go through and do that is required for them. And we try to make that transition very easy for them to help them with their insurance, explain what each part is, from supplements to Advantage plans to just to get them on the right track. And then they make their own choices of what's best for their needs.
Right, because there are so many different tiers in this.
Yes.
Part A and Part D. I mean, you know, just having seen my own parents navigate that. and understanding those. And then if you do have any kind of supplemental program, it can be a little bit complicated. And if you're transitioning, perhaps you're retiring and you've worked your whole life and you're like, this is a new adventure, you know, a new season, if you will. And you all really do try and make that as smooth as possible, right? We do.
We do. We try and make it very easy for them to understand, and we explain it. We sit down on one-on-one with them. That's why they call, they make appointments, and we provide that one-on-one contact with them and answer their questions and help them explain the process as they go along, because it is very confusing to them. It's very confusing.
Now, you all are going to take this a step further. You're having a program in October. Tell us about your annual Medicare update seminar and what you're planning.
Okay, that's going to be October the 2nd at 10:15. We are going to have representatives from our SHIP office in Raleigh are going to come in and explain to them what changes and what they need to look for 2025.
Okay.
Because open enrollment is coming up, and open enrollment starts for all our seniors in the county October the 15th through December the 7th. And that's a time and a place where they can come in and get ready to change if they want to change any of their insurance plans, ask any questions, maybe there's something cheaper out there for them. This is an opportunity for them to do it at this moment. So we're going to try and guide them through this step to help them, to make it an easy transition for them. And like I said, again, they come in and just make appointments, and we'll have one-on-one contact.
So to begin with, this is just an open forum day, time for this seminar to say, here are some updates, because things are fluid, things change, and they impact in our own personal lives. Things change, perhaps our needs change, perhaps our finances change, and so this is for that. But also, you mentioned that you are eligible for the program at 65. What about those of us who might be 63 or 64 and we're on the cusp of making that transition and being eligible? What do you recommend for those folks? Can they attend this as well?
They can attend that as well. We do have it's open up for disability people as well.
Okay.
Because disability people at the age of 62, they can apply as well. So it is open for all of those ages as well. Anybody past 62. We just explain everything of all the changes and everything that's going to occur, and it opens it up for questions too, if they might have some questions or concerns, and give them the information that's coming out for 2025 that affects them all.
Now, Denise, you are one person as the SHIP coordinator. How do you meet with all of these folks? Do you have some help? Do you have some support?
We do. I have some volunteers that do come in and they help. They're great. They're wonderful. They help. We make appointments and we schedule them according to their schedule coming in, and as well as I'm there. I prefer not to take walk-ins. They call, they make all their appointments, and we schedule it, and we manage to get through it, and we see them 5 days out of the week.
That's fantastic. Now, your SHIP volunteers are members of this peer group. These are folks who have been through this, so that they have that connection to your. Now, what if someone was interested in becoming a SHIP volunteer? Do you take volunteers? Are you currently taking volunteers now?
We do. There is an application process that they fill out, and there is a course that they do take. And once when they complete that course, then we go ahead and they become the volunteer, and we sit with them. And we appreciate that, because there's not very many volunteers out there, you know, to help us. So
being
we'll
able
take
to
it.
Have that extra set of hands there, that extra set of eyes for reviewing documents and assisting with that. Denise, we mentioned at the beginning of our conversation that you all are temporarily relocated. One more time, we want to make sure that folks know where to find you, not just for this seminar, but if they're eligible to participate in any of the awesome programs you all do. Remind us where the main senior services office is currently.
Okay, currently we're at 4955 Richlands Highway. We're right off of Highway 258 in the old, they call it the dollar store.
Right, the old dollar store.
Right there.
And you've got a great big sign out front, can't miss it. I understand that since you've been in that new location, folks have discovered you
Yes,
right, for the first time.
They're stopping in. They want to see what we're all about. They're coming in. We're giving them newsletters and calendars. Some of them are joining our activities, are growing. They really like and see what we're doing, and they're enjoying it. They're enjoying themselves. They're having fun. They're socializing, and that's what it's all about.
That's fantastic. Well, Denise Leyva, one more time, the annual Medicare update seminar is going to be hosted when and where?
It's going to be October the 2nd at 10:15 at 4955 Richlands Highway at our Senior Service Building, and we look forward to seeing all our seniors there.
Thank you so much for joining us.
Thank you.
Welcome back to Onslow County Today, and joining us now is Omega Jarman, Registrar of Deeds. Omega, thank you so much for being here.
Thank you for having me. I appreciate it.
You know, we were talking off camera about sort of the history of the Registrar of Deeds office, and you are the pinnacle record keeper storyteller of Onslow County. The role of the Registrar of Deeds has always been there, and it's where we find our most important documents.
Yes, ma'am.
And your office is not far from where we are today, and there is the story of Onslow County. And I cannot, tell you how much I enjoy the documents that we are able to access for that story. So first and foremost, before we move any further, I have to say thank you for that.
Thank you.
And thank you to your wonderful staff as well. What a team you have.
Yes, ma'am. I'm very blessed. I have a great group that I work with.
Now, as the keeper of those very important documents, the reason we're here today is to talk about some of the programs that you offer and some of the services. And the first thing we want to talk about is property check, because I know that that has been a challenge. I know that it makes people very nervous, the idea that perhaps someone could sell their home without their knowledge. And this is something that you all have worked very hard in terms of fraud protection. Tell us a little bit about what property check is and why it has been so effective.
Yes, ma'am. It is a thing that we have with our vendor, COT. They actually provide it, and of course, as soon as they let me know it was something we could do, actually the previous registrar started that, Becky Pollard.
Yes, ma'am.
And I've continued it because I do think it's a great thing for our citizen, and it is a free service. They can just go on our website, the Register of Deeds website. They can open up an account through Property Check where they would list their name in any manner that it could be listed. You know, because like women, we have our maiden name, then once we marry, we have possibly a different last name because we choose our husband's last name or our spouse's last name. So they would want to put in their name in any variation that it could be done. And then if that name was indexed, because we receive a document with that name, we would index it, and then once we've released it, if that happens to be your name, you would get notification either by email or a text, whichever method you choose, to let you know that there is a document that has been registered with our office with that name. It may not necessarily be you, because you know you may have a common name, but you would get notification of it. That way it wouldn't be something that would blindside you maybe 2 years down the road.
Right.
It doesn't keep the document off record, it just gives you notification. So if something has been done, then you can, you know, act immediately.
So in case, you know, this is not you. Right. And so such an important protection for property owners.
Yes, ma'am.
The other thing is that we want to talk about is we are very proud to be home to Marine Corps Base Camp Lejeune and New River Air Station, and our connection to our military service members and their family members. And one of the things that they have to process as they exit and in their time of active service is a DD-214, correct?
Yes, ma'am. Yes,
Explain to us what that form is. Those of us in the military who come from military backgrounds certainly know, but explain what that is and why that is so crucial to that military personnel's long-term record.
Right. Yes, ma'am. So once the military personnel is separating from the service and they're going to, go down a different path of life, they may still need to have their DD-214, which is the record of how they left the service, if it was honorable or not. But that record, it is very valuable. It's federally protected, so you don't find it anywhere and everywhere. Sometimes you have to get it, I think it's from Illinois, and it's kind of takes a while to do that. But if they have brought their original member 1, member 4, which I think now has changed to service 1 and service member 1.
Right.
They'll bring those to us. We record it in our office, the original document. We give them back their original. We just have a record of it, but we can do certified copies of it, which would act the same as their original.
Very good.
And they wouldn't have to use their original. At different times, they'll need to present it, or they to give a copy to prove things. But if they can use this certified copy, then their original is kept safe.
Very good.
And also, that is only available for the actual service member to bring in to record.
Okay.
And only the service member can obtain it later. Once the service member passes, then their spouse could get it, or of course, like Veteran Affairs could get it.
Right.
Of course, they have, the ability to get it. But something very important that we like to point out is if you do know that you have your spouse and you're going to want them to handle your affairs once you do pass, to make sure they know where these documents are. Unfortunately, in our office, we can't issue them to a spouse unless they can present the death certificate, which shows that they are the spouse still.
Right.
That's what proves that they were still married when they did pass. Sometimes that can be very difficult, and we have a hard time saying no, but we have to, you know, until we have the proof. This is all a free service, the recording, the obtaining certified copies. We dearly appreciate our members and the service that they have done for our country.
And by having that document, this vital document in their life story, knowing that it is in a place of safekeeping.
Yes, ma'am.
Absolutely.
Yes, ma'am.
Now, the last thing we want to talk about is other kinds of vital records, and that includes birth records. Oftentimes, we need our birth certificates. We need, perhaps we need that death certificate as proof of death, marriage licenses. And once again, you are the keeper of those stories for Onslow County. But there may be those, we know that this is a community that is quite transient, and perhaps we need a county record from another county in North Carolina. How do you all assist us with that? Because my husband is from Davidson County, and I need to get a record from Davidson County. What do we do?
Yes, ma'am. So if it is a birth record that you are searching for, and it is a North Carolina birth record, if the birth occurred after from 1971 to present, and there was no type of adoption involved, like step-parent adoption, any kind of adoption. If there was an adoption, we unfortunately would not be able to assist the citizen. But as long as there's not, then we should be able to get that for you. However, it is a little more costly. It's $24 for what we call out-of-county births, because we're actually getting it through the state vital record system. We're using their system. It's not a birth that we have in-house. Of course, if it's an Onslow County birth, and there's no adoption, then those are $10 for each certified copy.
All right,
if they're born here.
Very good.
Yes, ma'am.
Any other documents like those birth records that we could obtain from other counties?
So we have partnered again with our State Vital Records office, and we are able now to get death records that have occurred in other counties. Previously, you would always have to go to the actual county where the deceased took their last breath. And it's already a difficult time for families. So we are very excited that we can at least try to alleviate a little bit of pressure from them having to obtain it from the other counties now. It is a new system, and Vital Records is continually working and putting in previous deaths. But at this time, we're comfortable feeling that we can issue one from like the beginning of 2023 to current. As I say, they are continually putting in more deaths further back, but it's not been established to at what point. And unfortunately, when we go to search in the system, it only allows us one time to search, and if it doesn't come back with a record, they don't refund the money.
Okay.
So we definitely do not want to cause hardship and charge for something that we weren't able to issue. Right. And we try to make sure before we even attempt it, we'll even go to a further step of checking other counties if they have their birth or deaths listed on their website. We'll try to make sure that we see it there before we even go to the state system.
Oh, very
good. We definitely do not want to charge our citizens for something if we're not able to assist them with it.
Well, again, Amiga, you all are the keepers of those records for our for those milestones, for those moments in our life, from birth to death, marriage, changing, again, as we exit and separate from active duty service. You are the keeper of those records. I would love for you to share a couple of things. One, we know that Onslow County, we have lots of marriages.
Yes,
we have lots of babies being born, and again, you all have all those records that have to be maintained, but there are folks who may not be familiar with where you're actually located. So if they want to come and make an inquiry or ask for your assistance, let's direct them first to where your office is so they can easily find you.
Okay. So our physical address is 602 Ann Street. We are located in a new section of the courthouse that they added on.
Okay.
Our office doors actually face the river. It does have our name above the entryway on the brick outside, Register of Deeds.
Very good.
And I would love to give our number. If
Yes,
they
ma'am,
ever have any
please.
questions about anything we've talked about today, they definitely can call us. We'll be glad to assist them. Our main number is 910-347-3451.
Okay.
And of course, if they come in the office, we'll help them in any way we can. Sometimes, unfortunately, our hands are tied, but that is what we are there for, is to help our citizens. And we really enjoy it. Like you talked about the marriages and the new births, it's a very exciting time for families, and we're happy to be able to just be a little part of that. It brightens our day.
Well, that is wonderful, and it shows.
Yeah.
You've set that energy within your staff. They're wonderful to work with and are always just so gracious. We thank you for sharing that with us, Amiga. The last thing is, as you said, you are there as the keeper of those records, and many of your records, they don't need to even make a trip to see you. Please share a little bit about your website.
Right, yes ma'am. So if you wanted to search for your property deed or your deed of trust, or just to see what's recorded in your name, you can go directly to deeds.onslowcountync.gov. That is our search site. But our main site, like if you were not here and you needed to order a certificate online, we do that as well. You would go to the Onslow County website, you'd go to the Register of Deeds, and you would click Order Online. Because, as you said, we have very transient citizens here that move and go, and, they may have had their child here, or they may have gotten married here, but they now live in another state. They can always order those from us online. We always mail those out the following work day after we get the request, as long as they've, feel the need of satisfying that they are who they say they are.
Right,
of course, we have to try to make sure at our very best that this person is who they say they are before we issue a certificate.
Very good.
They can definitely do that. Again, it's 602 Ann Street is our physical address, and 910-347-3451. If they want to give us a call, we'll be able to walk them through any of our websites.
Fantastic. Well, Amiga Jarman, thank you. We are so grateful for having you with us today, and thank you for being that keeper of those records.
Thank you, Lisa. I really appreciate it. Thank you.
Welcome back to Onslow County today, and joining us now is one of our most familiar friends, Norman Bryson, Director of Onslow County Emergency Services. Norman, thank you for being here.
Lisa, thank you for having me.
You know, oftentimes, we're not doing it today, oftentimes we talk about hurricane season and what that means and what families should do. And in the wintertime, we meet back up again and talk about what it is to prepare for inclement weather during that season. But today, September, is Preparedness Month. And that means all types of preparedness we should think about in our own households. Please, as always, I want you to share what it means to be prepared and why that's so important. And then we're going to talk about some things that we can do, just general everyday preparedness.
Well, Lisa, when we start talking about preparedness, in Onslow County, hurricanes is one of those things that always comes up front to your mind.
Right.
But preparedness means many different things, just like what you were defining earlier. Preparedness is the hurricanes. We are susceptible to tornadoes here. We also have times of the year where wildfires. Yes. And yes, occasionally we do have snowstorms, but not just those types of large weather events should people be prepared for. There is the natural things that occur to you day to day in your life. You have fires that may occur in the home. You have vehicle accidents that may happen. Every bit of this, in any kind of emergency that may happen, is a form of preparedness that you need to be ready for, because as these things occur, it's about putting your life back together, you and your family, making sure you're getting back to what you consider that normalcy. So with September coming up, it's about preparedness, and it's not just one faceted, it is across the board. And as you and I have talked many times, it's not just a hurricane preparedness kit, it's an all hazards supply kit. So that's the thing we want people to get more and more with their minds wrapped around, is all hazards.
Right. So, a couple of Christmases ago, we had a dramatic weather shift, had been very beautiful, and then suddenly below freezing, people had water pipes freezing. Power went out, just at the holiday season, and it was thinking about how do you prepare when it's 5 degrees outside, when we don't see 5-degree weather, right?
It's very uncommon for us here, but it's not a myth. It does happen.
Right.
We've had times before in my past that we have actually seen 3 days consecutively after a ice storm where we did not get above freezing. Not to tell my age a little bit, but we can go back to 1989, which was a massive snowstorm that hit this area that came through and affected the county across the board, because at that point in time, the amount of snow we got then, the roads were shut down, you got too much ice and snow, you got power outages, lots of different effects occur. And it's been a while since we've seen that, but just don't think because it's been a long time it's not going to happen here anymore. Possibility is it can happen here again.
And then there are the events that are not even natural events. It's not weather related. Sometimes you may have issues with chemical leaks, spills, closing down areas from large motor vehicle accidents. And the one thing I always think about is how much in those times of emergency can I reach the people that I need to? My colleagues, my associates, and then certainly my family. In the times when we might be separated by any kind of event, how can I best communicate with them? Let's talk about how important it is and how we might develop a family or household emergency preparedness plan. And then how do we develop communication plans?
Well, there's a couple of different websites that you can go to that are already out there that can help you in developing these plans. You've got FEMA.org, you've got NC Ready. There are a couple places that you can go into, and they will talk about family preparedness plans that you can go ahead and start to develop. And one of the first things you want to do is kind of realize and develop what are the hazards that are around you in your community. What may affect you, because there are different things and they do change. Even with technology changes, we have different things. Let's talk about something people take, for granted. That is going to the sink and turning on the sink and having prepared water for you, because here in Onslow County, for the most part, we have water that is provided through Onwassa or through the city of Jacksonville, which is this potable water that has been prepared. And for years ago, we used to have large containers of chlorine that traveled in and around the county that went to these facilities to help in the chlorination of the water. Well, some of that has changed, where to reduce that hazard, they've moved over to more pelletized forms of chlorine instead of what is in the compressed tanks. So that has caused a reduction in the number of hazards we may see, but we still do have hazards in our community. We have a military community right here with us. So some of the things that you have to take into is, what are your corridors, what's around you, what's in your community, are there any things that are big processing plants, even some agricultural and farming areas. You have to take into account what they may be using in those areas for what you are preparing for. The other things you would take a look at is rivers, streams, what are your normal weather patterns. And even with weather patterns, it needs to be looking more than what happened in the last 5 to 10 years. You should be looking at what's happened in the last 5 to 10 decades over your area to get a better example of what's going on. And I'm going to give you an example of that. 1996, that is a big year here in Onslow County. That is the year that Bertha and Fran both made landfall in our area and started a huge amount of devastations. When I go out and talk to people about preparation and preparedness, especially with hurricanes, I often ask people, well, after Hurricane Hazel,
Right.
and between that and 54 to 1996, name me another hurricane that landed in our area.
Right.
Most people cannot tell you. So there was a long period of time that we did not have any hurricanes that really caused any great devastation in this area. You had Gloria and Diane that came close in the 80s, but then you're always back to the 1970s with Hurricane Ginger, which probably nobody can even remember Hurricane Ginger.
Right.
Was the next time it came in. So it's not just looking and what we're used to in the last 5 years. Look back in decades of what has occurred to you. Also looking at some of those technological changes or advancements that may be going on around your area and development. The other thing is talking about evacuations, and if you have to evacuate, what are your paths to get out? Well, paths here in Onslow County, they're limited. If you're needing to leave Onslow County, you've got 258, you've got 24, 50 if you're in the lower areas. Maybe you're going to ride down to Wilmington and hit 40, but there's going to be probably a lot of other people that direction. And then you've got 17 that carries you out to a few corridors to the north. After that, it's very, very limited on mass transit systems. And all this is information gathering for your area and development of that plan. But you could sit down with the plan, start developing it with your family. The communications piece that you talked about earlier is very, very key, because you're also going to teach this to your children about that forms of communication and who they need to make contact with, because it needs to be more than just your immediate circle. If there's other family members that are outside the area, to letting them know what's going on, just to be up to date with what's going on in the community with the family. And maybe you're for some reason separated from your family, and the only form of communication maybe come in from a couple of different parts to that family member. So there's a lot of pieces.
There are a lot of pieces. I was sitting there thinking about, as you sit at the dinner table and you talk about how do we prepare as a family. And you certainly don't want to scare your children, but you and I both have adult children, but you probably remember a time when your children didn't know you had a real name. Right?
It was Dad.
You were Dad, right? And so how important it is to teach our children those things like, what is your name? What is your address? What is your telephone number? In the event, perish forbid, you would be separated. And having that larger circle of family responders. Perhaps your school gets out for unbeknownst to you, and somebody has to be at your house, or somebody has to pick up that little person from school for whatever situation.
And you're right about teaching them all of these pieces and basic information. A lot of people say, well, I can put it in a cell phone or something like that. Something can happen to that technology, it get lost. They need to know your name. They need to know that address and know those phone numbers. I mean, even today, while my mother's phone has not been connected for decades, I can still today tell you what that original phone number was
Right.
back to her house. So it's part of, teaching them that process, because it is more than just you, it is down to the family. And we're talking about, again, we're talking about if the house is on fire, if there is some kind of accident and chemical leak, then we're talking about in those bigger events, the hurricanes, the tornadoes, any of those things. And yes, we're not trying to scare people, but the better prepared you are, the less frightful it can be.
We talk about that idea of coming through an event and the recovery side, and this just builds strong community. This builds resiliency, that ability to come back and bounce back from that. And I think that Onslow County is one that is a phenomenal example of how we've done that from different events. Key to that is your department, Norman. People oftentimes associate what you do with fire trucks and EMTs and paramedics. Certainly you're that first responder and public safety. But your office is all about education as well, that preparedness is key so that when we get on the other side or when we're in the midst of an event, we're the best prepared we can all be, not just you as an agency or the county as a governmental entity, but you want that for the safety of our citizens.
Absolutely, because the first thing is the safer our citizens are, the better off we are, the less we have to worry about. One of the things that we always talk to people about, there comes a point in time in a hurricane event that we cannot come to you because it's too dangerous.
Right.
If we can get the population in a safe location or out of the way of the storm, and they're prepared to be able to help themselves in the aftermath for putting it back, insurance policies, lots of data and information that you may need as well, deeds that you may have, having all that information put together somewhere safe to help, like I said, bring your life back to normalcy, but also that up front and making sure that the public is absolutely as safe as they possibly can. We want our first responders to be as absolutely safe as they possibly can as well. Because, the key goal here is we really don't want to lose any life in any of these storms at all. And you also have to take into account for family members and their own physical health. Are they able to survive or ride out the area that we may be in with no air conditioning, no electricity, if they're on oxygen, their ability to get certain medications and drugs, dialysis? All those pieces have to be taken into account for their overall survivability, and that's, again, part of building that plan. And there's the other piece that I always remind people about as well, and that's your other four-legged family,
Right.
your pets.
Absolutely.
Because, we have lots of homes. The animals have to be taken care of as well, and being prepared for taking care of those animals, because a lot of us, especially as you get older, those pets take the place where your children have moved on, they're not around the area. So you have to make sure there's food for them, they're able to be taken care of as well.
So it is a household preparedness plan. And the final piece of the puzzle is there are also lots of resources out there to notify you, to let you know in the event that perhaps there was a situation, perhaps any kind of chemical spill or anything of that nature, where we would want people to shelter in place, or we would want people to evacuate, or we would want to notify them of routes or any kind of updated information. And so talk a little bit about the role of the county and municipalities, or even statewide notifications that we sometimes receive, how important it is to monitor situations and just have those just in case notification pieces.
So there's lots of different forms of notification. If you're in Onslow County, one of the pieces we have is Alert Onslow that we can actually use to notify the public and let them know what's going on. Now, I want to let everybody understand, we use Alert Onslow for lots of different pieces.
Right.
It's not just a hurricane is coming or a tornado is hit. It is also, we use that if we have a missing child and we're looking for someone. So I want people to be aware when you're signing up for this, there may be other things other than just weather alerts that you're getting, because it is key to survival in and around our community.
Absolutely.
But other places and stuff that you can go to is there's our county website that you can be able to pull information from, even from the state and local government. The other big piece is make sure you're getting information from a trusted location. We also have our own Facebooks and Twitter sites that we are putting information out through to our communities as well. I talked about that trusted piece. Make sure where you're getting that information on Facebook is a trusted site and source, because not all that information is good information. Sometimes it is someone is even duping and copying what we're doing and then changing some of that information. So you have to be careful. Make sure you got a good trusted site. Even in our times of years, weather is one of those things that maybe I sound like an old person, but weather is something that you should keep up with on a daily basis of what's going on around you, so there are no surprises. Because, there's so much that goes on. Here in North Carolina, there's the saying, if you don't like the weather, give it 10 minutes, it'll change. And it does. You could have what looks like a perfectly good day in the evening, in the morning time, and by the evening time, you've got severe thunderstorms coming into our area. You've always got potentials. We have seasons out there, and even in those seasons, you can have the chance of events occurring. A tornado could almost occur any time of the year, to be perfectly honest with you, even though you have a certain season. But going back to that notification piece and where do you go, Onslow County has lots of different sites and locations that you can get up with. Make sure you're watching trusted news sources. Even with the state and federal governments also has some of their sites, NC-Ready, FEMA.org. You can be able to get information from as well.
Fantastic. Well, bottom line, this is not about fear. This is not about being scared. This is about being prepared so that regardless of the event, we can do the very best we can. Norman, the last piece I want you to add is just please one more time remind people of those great websites and also how they can reach out. Oftentimes we may have civic groups, church groups, classes where school is back in session, where teachers might want, educators might want someone from your team to come and speak to their group. How can they best reach you all?
So a couple of things is those websites and stuff you're talking about. So the first one is FEMA.org. The other one is NC-Ready. And then the third one would be our Onslow County website, go under Department of Emergency Services, Emergency Management. Now, if someone wants us to come out and be able to provide them information, because we have lots of different presentations built around different types of events, disasters, preparation, you can call our office at 910-347-4270. Ask for either myself or my Deputy Director, Stacy Miles. If we're not there, of course, you can leave a message and we'll get back up with you. But we go out, we are always love giving presentations and meeting with our public and talking about the preparation and helping people to be ready for these. Because just like what we're talking about today, what we're wanting to do is not provide fear, we want to provide knowledge, and knowledge equals toward readiness and preparedness.
Very good. Well, Norman Bryson, thank you as always. Thank you for helping us be as safe and prepared as we can possibly be. We appreciate your time.
Thank you, Lisa.
Welcome back to Onslow County Today, and joining us again is Danny Cook from Onslow County Animal Services. Danny, thanks for coming back.
Thanks for asking me back.
So you all have had a summer full of activities, a busy season, and currently you're in the middle of a Clear the Shelter event. Explain what that means and sort of what your goals are for that.
So Clear the Shelter is a national event. Hill's Science Diet actually kind of backs it. And basically what it is, all adoptions are at discounted prices. The goal is to get animals out so we are able to save more lives and save more animals. Unfortunately, we are pretty full right now. So getting kids out faster will help with all the stuff that are coming in.
So we see that you all probably in the summertime, we know that there's an increase in population and strays that might make their way out into the world, sadly, because of events happening at home and all the activities that are going on. And families sometimes are leaving the area. So this is this is that transition season for you all, but you want to find new homes for all of our furry friends.
Yes, desperately.
Now, you know, one of the great ways we see that you all do that is your website and
Yes.
your social media postings, which I think are phenomenal. And everybody, you know, you look and you're like, oh, I think that's my soulmate, right? Talk a little bit about the connections, because the other thing you do is you do post when families come in and add that
Adopt
new
their
furry
pictures.
member. Yeah, your adoption pictures are fantastic.
Yeah.
Talk about how that has really grown and what you're hearing from your families.
So that's one of my favorite things about this is a lot of people come in, they're not sure what they are looking for sometimes, and so they meet a couple of the animals and they're like, I didn't think I would like that one, but that one's kind of my spirit creature. And I'm like, I can relate. I've got one of those at home.
Right.
They meet and greet them. They hang out with them a little bit. They'll leave to think things over, and they come back and they're like, yeah, we can't. We need that one. I'm like, okay, that's awesome.
This is my this is my spirit animal. This is my soulmate.
Yes.
This is my long lost family member I didn't know I needed.
Yes.
Now, you all had this Clear the Shelter event. I know you said it a little bit slow because you've got a lot of friends who have come in recently.
We have a lot of friends that have come in recently. So the other day, I want to say we had maybe 8 or 9 adoptions, but then we also had like almost 12 animals come in.
Oh.
So it's
we got to
make more room.
And that's why we're here. We want to
Yes.
let people know that the Onslow County Animal Services and Shelter there has got that forever family member waiting for them. The other thing is you've got a special event coming up
do.
very soon. What's
Yes,
going on?
I'm very excited about it. So we have a vendor event that I'm hoping to make an annual thing
Very
at some
good.
point. With Clear the Shelters, that's been running since August 10th and it'll run until September the 10th. We've been doing discounted adoption fees for both cats and dogs and kittens. Puppies are not included, unfortunately.
Okay.
But on September 7th from 12 to 5, I have a vendor event that's kind of mushed into the Clear the Shelter event.
Okay.
I will have some vendors there. I've got Pause for Purpose coming. I've got Coastal Emergency coming. I've got Adoption First coming. I've got 5 or 6 other ones coming. They're all going to be there to help us try to get all these animals out. And the fun part about it, we're expecting it to be a little busy that day. Adoption fees are sponsored that day, which
Oh, my
means that we've
lands.
had some amazing people in the community and whatnot that have made donations towards sponsorships for these animals. So as a last hurrah, last weekend of Clear the Shelter, we're trying to get them all out.
That is amazing. So they're assisting with that, sponsoring those adoption fees so that they can help. Perhaps a family can't, really meet that, but know that this is what they would love to have. And so that's filling voids in 2 lives.
We're
right?
trying.
That's amazing. That's wonderful. Now, for folks who want to know, who may not be familiar, we know that this is a time of transition when lots of new families may have moved into our area. Let's remind folks where you all are located and how they can follow you on social media to learn more.
Okay, so our Facebook page, Onslow County Animal Services, we keep all of our information there. Like we have pictures of our adoptions, featured pets that have been there maybe a little longer than we'd like, animals that are just coming onto the adoption floor, so we kind of list everything there. We also, our manager is pretty awesome at leaving every month our stats, so our numbers of what came in, what went out, that type of thing, just so everybody knows what's actually going on at the shelter, which I think is great. You can also visit us at the shelter. It's 244 Georgetown Road.
There you go.
It's right there, right next to the Onwassa building.
Very good. So if you come off of 17, it's in that curve there, Georgetown and Broadhurst. If folks are familiar with the fairgrounds,
Yes.
Board of Education,
Yes.
certainly Onwassa, and then you all are there.
Yes, elections building, we're right there.
Right there in that behind the little Georgetown Park.
Yes.
And again, when they visit the site, it's really about figuring out that connection.
Yes.
Making that connection with that new family member. Danny, it is always a joy talking with you. It is obvious that what you do, you love.
Yes.
And you know your why. So thank you for being here, and thank you for sharing that. Again, we're going to look September the 7th.
September the 7th, it's a Saturday, and it's going to be from 12 to 5 that day.
Fantastic. Thank you as always for being here. Welcome back to Onslow County Today, and joining us now is Matt Mano from the Onslow County Health Department. Matt, welcome back to Onslow County Today.
It's always great to be here with you.
You know, Matt, so much about what we think of the health department is in that immediate. We go there for our back to school vaccinations, which we've talked about so many times. We talk about well visits, but you all are so much about public education.
Absolutely.
And public need and being that resource. And we've got a really very serious topic that we want to talk about this month, and that is suicide prevention. Talk about how you all have made that a priority at the Onslow County Health Department.
Absolutely. So we've been looking over the past few months, and we've been looking at state statistics, Onslow County statistics. Of course, one of the big drivers for us is being data driven. So whenever we see those priorities and those needs, we want to look at qualitative, what's happening within our county, but we also want to look at quantitative. We want to see what the data shows. And what we've found from the North Carolina State Center for Health Statistics is that suicide is number 8 in the top 10 leading deaths in Onslow County.
Now, when we think about that, those numbers tell us so much, right? It's not just the number itself, but how things are weighted and that what we're looking at versus, and you all, are always in that assessment mode. We do a community-wide health assessment.
Absolutely.
And that's looking at need, that's looking at need for resources. What do these numbers tell you?
One of the big things that we're always looking at is it's difficult to just compare with your flat numbers of what you're looking at from county to county, from county to state. And so what we look at is our rates. So we look at suicides per 100,000 for population. That's kind of the way that we can standardize it. So whenever we're looking at the population of North Carolina as a whole and the population of Onslow County, if you were to look at the number of suicides and compare them, of course North Carolina would look like more because you're looking at a much larger population.
Right.
So we break that down into an equation that shows the rate per 100,000. And so what we've noticed from 2018 to 2022 that has been verified from the state so far, the state has run around 16 per 100,000. Onslow County stays around 25. And so we're much higher than the state, even in our per 100,000 rate.
Now, are we also looking, when we look at that rate, are we looking at demographic information as well?
Yes. So we're comparing our rates with the state, and then our health education team also looks at death certificates from the Register of Deeds to see our suicides and to be able to look at that demographic data. Within that, we find that most of it is between the 18 to 24 age range. We're looking at mostly white males that have achieved a high school or GED education equivalent. And then a lot of those are falling within the construction blue collar industry for their occupations. And then for modes of suicide as well, we look at that too, because we want to see, of course, what are some of the prevention methods that we can help incorporate throughout the community for this? Because like you said, we have our clinics and everything at the health department for services, but one of the big things we want to do is prevention. So suicide prevention, chronic disease prevention, we want to fix it upstream before it becomes an issue. And so we look at those modes of suicide and we find 70% of them are done with a firearm, about 25% are with hanging. So whenever we think about what can we do to help prevent this from happening in the community, we think about suicide. It is a forever decision. And so one of those things that we look at, there's lots of resources as far as training in the community. They have gatekeeper training for suicide prevention. They have mental health and wellness training, and mental health first aid training. And so one of the things that the health department's been doing, the state has provided from one of their strategies, is gun locks. And so one of the things that we do at our outreaches is we promote locking up your guns. And the biggest thing is, one, because we don't want any unwanted firearms going off, of course, you know, kids,
Right.
loaded guns, anything like that. But also too, because it's an evidence-based strategy, is that if you have a gun lock and you have somebody that's contemplating suicide, the time that it takes for them to unlock that gun could be the time that it helps them get back to, wait a minute, I don't want to do this.
That split second, just in that
Absolutely.
moment, that pause, that is in that moment of fear, desperation, whatever that moment is that's driving that split second can make that literal life or death
Yes.
situation. Now, gun lock certainly. Other means of education that you all are looking at,
Yeah.
because the conversation around mental health is that we destigmatize the concerns within the community, that we say, help us bring this to the light so that we can help you.
Absolutely. So one of the things that we have kicked up, and we're partnering with the state on a strategy for too, is suicide prevention throughout the county. And so our health educators are going out, we're incorporating QPR training, which is from, it's an acronym. We love acronyms at the health department.
Right.
So QPR is question, persuade, refer. And so it's a training that can be incorporated anywhere throughout the community, and it helps individuals to recognize signs of suicide, suicidal ideations, and then be able to question those individuals that they think might be in a crisis. Question them, are they thinking about contemplating suicide? One of the things in the stigma that people think about is, oh, if I ask them, I don't want to give them the thought. But if they're already thinking about it, it's asking somebody if they're contemplating suicide is not going to give them the thought of suicide.
Right.
That's one of the first steps, is to ask them. So questioning the individuals, persuading them, letting them know that there are people that care about them, that love them. There are reasons why they need to stay here. And so questioning them, and then next is to help refer them to resources that they can access to be able to help them during that crisis. And then beyond that, because it's one thing to get them past the thought of suicide, but then there's obviously other issues that they are probably going to need to work through to be able to move past that. And so one thing that we're always saying is mental health is health too. And the QPR method is kind of mental CPR. You're thinking about mental health for CPR. So you have somebody that goes into cardiac arrest, you're doing CPR, you're trying to revive them. QPR is a similar thing, but for somebody that's having a mental health crisis for suicide. And so QPR is one of those things that we're looking to implement throughout the county, and also to implement with different community agencies to implement suicide prevention training within each of their staffs too.
That was, you're following right exactly what I was thinking about. You all are one agency. We do this as a community.
Absolutely.
We do this as a family, as a village.
Yes.
Right?
Yes.
So talk about the partnerships, because when we're looking at that age group, this is not an age group. We're out of high school. Maybe we're in a workforce, but in a workforce that perhaps is not one that would lean into conversations about our mental health or our emotional well-being. We're working, we're literally working in our day-to-day life and then going home.
Yeah.
So how do we reach that pocket? Because when I'm hearing those demographics, this is not someone who might easily be within the reach.
Right. And that's one of the things, again, like you said, destigmatizing it. We want to be able to reach out to our community agencies, and we have strong partnerships with our healthcare community, with our emergency services, with our different departments throughout the county. And we also want to build those partnerships with, again, how I was saying that one of the biggest occupational areas is construction. And so we want to be able to reach out to our businesses to promote suicide prevention within them, because you think about how much time an individual spends in the workplace, that could be the time that their boss or manager, supervisor, or coworker can notice those signs.
Right.
And so being able to implement QPR training with those individuals adds that, not added layer, but it does help to kind of educate and inform additional people within the community, so that it's not just the individual that is in crisis, they leave, nobody thinks to question, oh, they were just having an off day. And so what we want to do is be able to partner with those individuals that we've noticed, or with those agencies that we've noticed, where we can focus on the demographics that we see this happening most often with. We want to, of course, implement it throughout the whole county.
Sure.
But whenever you see who it's affecting most, we want to make sure that we are focusing on those two.
Figuring out how to reach
Absolutely.
that community, but also in when I'm thinking about, before we reach that point, is also figuring out how that people can communicate their feelings, their moments, before we reach that moment of crisis as well.
Yes.
Talk a little bit about when you all did the community health assessment, when you all have spoken with your community partners, how important it is to increase that communication.
Absolutely.
And the resources.
Yeah, that's one of the big thing with the health department is we know that we can't do it all, but we have resources to be able to point people to different areas that specialize in certain areas. And so one of the things with our community health needs assessment that we identify is where are the gaps, or what are we missing, or what do we need to connect to? And so we think about our different agencies that we need to help incorporate this in or utilize as partners. So with the community health needs assessment, we of course can take a look from different other sources like county health rankings to see how many mental health providers do we have, like in a ratio 1 to how many to be able to serve our community. And so we have mental health providers. I think the biggest thing is destigmatizing mental health to show people we need to open up. You need to share your feelings. If you're having a crisis, you have individuals that care about you. You have professionals that are here to serve our community. And one of the biggest things that we push out, of course, is 988. So that's the mental health hotline. So if you or an individual are in some sort of mental health crisis or having suicidal ideations, you can dial 988. Very similar to 911. It'll get you in contact with an individual that can help walk you through that, or that can resource you if you know of somebody that's having a crisis as well.
I don't think we can stress that enough. It's in the moment.
Yes.
We're not waiting to get an appointment. We're not waiting, I'll see my friend tomorrow, and we're not waiting.
Right.
There's not a voicemail. It's in the moment.
Exactly, and that's the best thing about the hotline. And of course, throughout the county too, we have mobile crisis as well that helps to be able to respond to those incidents, like you said, in the moment. And we want to be able to make sure that those minutes count. We want to make sure that people are getting the help that they need as soon as they can, so that no forever decisions are made.
No forever decisions are made. Matt Mano, you and I have had many conversations over the years. Thank you for this.
Absolutely.
Welcome back to Onslow County Today, and joining us now is Tori Parks from our Onslow County Public Library System. Tori, thanks for being here.
Thanks for
and
having
thanks
me.
for bringing your friend.
Yes, this is my friend.
Does he travel with you everywhere?
This month, yes, he will.
Is this how you get through the carpool lanes? Mm-hmm. Just put him in the passenger seat?
Oh yeah, it's a kick.
Awesome blossom. Remind me who this is.
This is Optimus Prime.
Okay, and you brought a transformer with you because libraries are transformative.
Yes, but September is National Library Card Sign-Up Month.
Okay.
And our theme this year is all about transforming and transformations. So we have him with us, and every time I think of him, it makes me think of the library and the transformations that reading does for us.
That is fantastic. Well, while I'm not a transformer expert, I am an expert in how books make a difference in our lives. And your library has been part of my life, my whole life.
Right.
And so we can all speak to the power of books and their transformative power. So we want to make sure everybody has the key to that, and that is a library card. What are you all doing for National Library Card Sign-Up Month?
So we have a lot of new programs happening in September, of course. When you sign up for a new library card, of course, you get your welcome packet that has all of your information in it, your calendars, your newsletters, all the different resources, Hoopla, Libby, how we can help you, all the resources that we offer, everything online, all of that. And this month, we have a goal. So last year, we were very close to this number, so we are quite certain that we can achieve this goal this year. Our goal is to sign up 850 new library card members.
Well, that is fantastic. All over the county. We had lots of folks who went from 4 to 5, so we just got to get those 5-year-olds in there,
Yes,
right?
we do. Yes.
And so get our own library card. Let's explain to folks why we say that 4 to 5, because to have your own library card, all you have to do is what? Be able to...
You have to be able to sign your name.
Be able to sign your name. And with school starting back, this is the perfect time.
It is.
To do that as well. Now, we want to make sure, are you all hosting any kind of special events or any special initiatives associated with National Library Card sign up?
So we actually have quite a few themed bookmarks that are in our libraries.
Fun.
Our newsletter has our transformer on it. And then of course we always have a little bit of swag stashed behind our desk for our new members.
Well, you know, just the library card's pretty swaggy because you get to pick whatever beautiful scene.
You do.
I have a sea turtle on mine.
I have a sea turtle as well. My son has the dog.
Fantastic. So get in there, sign up, any of your branches. And the best part about a library card and the transformation that it gives you is it's absolutely
Free.
Absolutely your access, your ticket to all of these adventures.
Yes, exactly.
Adventures. Now, at each of our main branches, you also have lots of fun things going on and some new initiatives. We've come through summer reading. You and Miss Jen visited with us and talked about how incredible this year was.
Yes.
And now we're transitioning into the fall season and new programming schedules coming up. What are some things we can look forward to?
So at our main branch, we have a new class that's starting, and it's all about a nonprofit organization that's called Discover Candid. So they actually work with other nonprofits to help them be able to write grants and earn those grants.
Fantastic.
So that is a program that we're going to have coming up that Sinatra Spearman will be leading. So that's coming up this month. At our Richlands branch, we are adding on to our story time. So we are now having a new program for 4 and 5-year-olds called Book Buddies. It'll be every Tuesday at 10:30 in the morning. So we're excited about that.
Yes.
We're also going to be having a bilingual story time.
Yes.
So I know that that is very important to help us reach all of those different languages and really help those young readers.
Maya and Iceland.
Yes.
We're so excited to see what they're bringing.
I am very excited, yes. And then in Sneads Ferry, continuing with cultural celebrations, they are having an All Together Now cultural celebration in September to talk about Hispanic Heritage Month. So they'll have games and themed foods and all different kinds of activities there. So we're excited about that.
Awesome.
And then to round it all out, over in Swansboro, we also have a Fall Family Festival that's coming up. So they will be having that outside, and they'll have lots of outdoor games and activities and crafts.
So that'll be the end of September. I know because the museum's going to join you at that
Yes.
event, so we're excited to be there with Miss Anna and the team down at your Family Fun Festival down in Swansboro.
Yes.
You know, that is the great thing is we've just said what's at Maine, what's at Swansboro, what's at Richlands, what's at Sneads Ferry. The best part is our libraries are located in every corner of the county.
Yes.
Talk about how each of those places serves that community so specifically and so well.
So it's funny that you ask that. So we typically get together, and even though we're all in different places, we're all still part of one library. So we all discuss what we think our certain area needs, the demographics that we serve, and then we also kind of branch off of each other as well and get ideas from each other, because we like to stay cohesive throughout as far as our programming goes, but it's also nice to offer certain things in certain areas that we might need. So we're really working on just working together and really branching out.
That is wonderful. Also, we want to direct people because that is just the tip of the iceberg about
Yes.
what's going on at our libraries this month. Let's direct people to your social media and your website because there's lots more details there.
Yes, so you can find us on Facebook. We post daily. You can also find us on our website. We have all of our events uploaded in our calendar. We have all of them located in different tabs throughout. Our newsletter is on there. In every branch you can find our newsletter printout, and we also have monthly calendars at the branch as well.
Very good. Well, Tori, it is always a joy talking with you. Appreciate you bringing your friend with us.
Hey, thanks for having us.
As you all leave, we'll remind folks one more time, get that library card.
Yes.
And be transformed.
Yes, be transformed and help us reach our goal.
Welcome back to Onslow County Today, and joining us now is Aisha Ford from Onslow County Health Department. Aisha, thank you for being here today.
Thank you for having me again.
You know, school has started. Our kiddos are back in school, and we talk a lot about the need for routine. So that our kiddos are as healthy and happy as possible. And one of the big challenges that you all are addressing at the health department is the concerns about childhood obesity. And we're looking at right now September as Childhood Obesity Awareness Month. And you all have some programs, some important programs for making sure that our children are as healthy as they can possibly be. We want to talk about what really sort of defines childhood obesity. What are some of the trends that you've seen, some programs that you all have available, and certainly why we want these routines in their life, so that we're not creating stigma, we're not creating shame, but this is about really making these healthy choices and having these options available. So first things first, let's really sort of define or think about and the trends that we've seen in the health community around childhood obesity.
Well, it really goes, it really is related to a child's height and their weight proportion. Okay. We have seen, I mean, childhood obesity is a significant problem in the community in the U.S. I mean, 1 out of 5 children are obese. And the issue is that childhood obesity could lead to several long-term health conditions such as diabetes, heart trouble, sleeping disorders, and other unhealthy, conditions, even financial difficulty later on in life in adulthood. And so in September, this September particularly, we're focusing on shaping a healthier generation.
I love that. I like that, shaping a healthier generation.
Yes, and we want to focus on increasing awareness among the community about childhood obesity being a society issue. Everyone has to be involved. The community, the healthcare providers, families, and the child. So our programs at the health department are focused around educating the family, not just the child, which, mom and dad is going to be there when we're educating the child. But as a family unit, as a community, we need to, focus on the issue so we can take action to a solution.
Well, that's part of the challenge too, right? So if we as parents were not educated about those things, if we were perhaps raised in a household where it was grab food on the run or grab fast food, or if we don't have a tradition of sitting around the family table and having dinner together and looking at the foods that we're eating, even the process of going grocery shopping, then you all are filling that gap and helping that next generation.
Right.
So let's talk a little bit about that, shaping the healthy next generation, right? Let's talk a little bit about those programs themselves.
Yes. So the key, again, is healthy habits. So developing those healthy habits early, such as, good eating habits. We want to encourage our children to eat a healthy, hearty breakfast and lunch, whether they're at school or at home. Encourage them to try new foods, even the ones that we don't like.
Oh, there's a tricky question.
That's tricky because, as you mentioned, if we don't have healthy habits, our kids could, start picking up on those habits as well. So we're encouraged to, if you don't like, say, zucchini, encourage your child to try it. Also, making sure they get enough rest. Rest is definitely linked to obesity, poor sleep habits, lower grades in school, because we all need an adequate amount of rest.
Right.
And limiting screen time. because the more screen time that a child has, the less, they're going to be active and doing something to get their body moving and, build those muscles and stretch build those bones and stretch those muscles.
And you're not talking about an exercise program. You're not saying, oh, you have to get out, and it's about being a kid and being outside and playing. Absolutely,
and this is where the community can come in, where we have programs in the community at Parks and Rec for encourage them to go try out for, cheerleading or soccer or, football, basketball, anything that they have available. They have a lot of, activities. I'm not the expert on that calendar, but there is definitely a calendar.
There. Absolutely.
Yes, and it's stocked full of activities that they can do, or there's activities that they can do alone with their friends, just, going outside, jumping rope with a friend, riding a bike, walking to school instead of, if it's safe. Walkability is important in this community. We're getting more sidewalks, taking advantage of those sidewalks and things like that. So you don't have to have a membership to a gym or, and it doesn't have to always be an organized sport or activity. It could be something as simple as going out with the family after dinner for a nice little walk with the dog or, just with each other.
Just being together and making it, as you said, a family event.
Yes.
And a family habit, creating those routines, creating those habits, being outside a little bit more. And as I say, it's how you learn about making those choices.
Yeah.
Because it's not about either good food and bad food that, that was bad. We don't want to create that sense or that culture or ideas about shame associated with things. Talk about all things in moderation,
all
right?
All things in moderation.
Now, the other thing is, though, for some families, buying groceries might pose some challenges, getting those adequate resources.
Okay.
And the health department has such a valuable program in place, and that's our WIC program.
Yeah.
Talk about that a little bit.
So we do provide a host of education at the health department, and one of those programs is the WIC program, the Women, Infants, and Children program, where we provide individualized counseling for the family and the individual. And a topic that we focus on a lot is the healthy shopping on a budget, meal planning on a budget.
Yes.
Another program we have is the Healthy for Life. That's a virtual class that families can attend, no registration, no sign up, just click on the Zoom link every second Tuesday of the month.
Okay.
If I'm wrong, it's on our website. It's on our website at the Onslow County Health Department website that it's advertised, but they can learn many cooking skills, kitchen techniques, how to incorporate the child into helping you in the kitchen, because children that help in the kitchen are more likely to try new foods and be more adventurous with meals and things like that. That's a tip that we often give for picky eating. And we also have a Healthy Child program that's in person, and it's formatted for the whole family to learn about the same techniques, healthy shopping, healthy snacks, healthy drink choices, because that's often an area where you can get those sneaky calories in.
Yes, yeah.
But healthy drink choices is really important too.
And I think that that's so important, is to talk about this element of fun, right? That being in the kitchen and cooking is a family adventure.
Yes.
And it doesn't have to be, we don't have to be the next food television star, but it can be a lot of fun to learn how to do new things, whether that's knife skills and safe cutting. A lot of times when when kiddos can make their own snacks, right? They have that ownership of it, things like that.
Absolutely. And it's same with shopping. If the child goes shopping, children that go shopping can help pick out the food, they're more likely to try it.
Very good.
Yes.
I know that even some of our grocery stores have set aside, when you walk in the store, hey kids, here's a healthy snack.
Yes.
As you walk around.
Yes.
So grab, a little cutie orange or an apple or something like that. So that's awesome. Aisha, for families who want to know more about how to participate in your programs, we want to first tell them where our health department is located. We said, you know, this is a real time of transition in our community with lots of new families moving in, this back to school time. Tell us where you're located and how can we reach out to you?
Okay, so all of the programs that I mentioned are located at the Consolidated Human Services building on 612 College Street, or they can give us a call at 910-347-2154, or they can visit us online at the Onslow County Health Department Facebook page, as well as the same for Instagram.
Fantastic. Well, again, thank you for bringing, you know, this key important information. We want to make sure that that next generation is healthy as they can possibly be.
Absolutely. Thank you for having me.
Welcome back to Onslow County Today. Joining us now is the Honorable Christopher Thomas, Sheriff of Onslow County, and Veronica Ortiz from Onslow County Consolidated Human Services. Veronica, when we last met, we were talking about the opioid settlement fund and treatment and how we are addressing the issue of substance use in Onslow County. And when we closed out that segment off camera, you said, next time, can we be with the sheriff and talk about our new partnership? And we said, let's do it. So here we are, Sheriff. Thank you for having us here at the Justice Complex to talk about this really important topic that has really, pandemic is not strong enough word about substance use and abuse across our country. And Veronica, the opioid settlement fund has allowed us to begin addressing that. Let's talk first about the funding for this partnership and how it came to be. Sheriff, then we want to really talk about why this was so important to you and what we're seeing happen here at our Onslow County Detention Center. So Veronica, let's first talk a little bit about the funding sources.
So we received 2 federal grants from the COSUP administration to fund medication-assisted treatment and substance use counseling, peer support, case management, just wraparound services. And then opioid settlement funds fills in the gaps of things that the grants can't cover.
So you've specifically applied for these grants to work with law enforcement and folks who are incarcerated, who've been arrested, just for drug-related offenses or other offenses where we might have seen that drugs played a part in this, that opioids perhaps played a part in this?
So the grants were written not necessarily for the offense itself, but the individuals who were coming in struggling with substance use. Okay. So an individual could come in for a completely unrelated charge, but upon a booking, you know, if they're recognized as a substance user, then we front load them with services and try to treat them and offer them the services for substance use treatment.
Very good. Sheriff, when we were talking a little bit off camera before, as we were getting really kind of oriented to the conversation, you mentioned that you had tried this several years ago, and we were in the midst of COVID, and it was very difficult. And now you've got this new partnership. Why was this so important? Why were you clung to this idea that we can make this happen?
Well, I mean, close to 80% of all crime is related to some kind of addiction. Maybe alcohol, but opioids are becoming a very close second. Most of the individuals in our facility that are repeat or offenders that are always coming in through basically a revolving door have an addiction issue. So pushing this forward and try to help stop that, one, it helps the individual break a cycle. 2, it saves my staff trouble with dealing with these individuals, and ultimately it saves taxpayer dollars.
And when we're doing that, when we're talking about this idea of a revolving door, this is because they've not been able to access, for whatever reason, not been able to access the help that they've needed to overcome that substance use issue that they have, and are going back out into the world, coming back, and you wanted to change that cycle.
Well, if an individual is arrested and they come here and stay 4, 5, 6 months pending trial, and they go to trial, they're either placed on probation or sent to a DAC, but they get back out. if there's not been some kind of treatment, there's not been some kind of intervention, or at least attempts to get these individuals to accept help, get into counseling, then they're going to go back out. They're going to go back into the same circle or the same cycle that they were in to start with, and they will very soon be back at my door.
Yes, sir. Yes, sir. And Veronica, you all are filling that gap. You all have, here was an opportunity to serve the community in number of ways. You're serving the individual, but you're serving the greater community. Talk about those early conversations of creating this partnership.
Well, I mean, originally it was interesting to get a partnership of this manner in the detention center, because traditionally we house individuals and try to keep them safe until they go to trial.
Yes, sir.
And make sure their medical needs, as far as, you know, if they're injured or have some other medical problem other than addiction, that we address that. But with the addiction increasing and the volume of individuals we have that have these problems increasing within our facility, was costing us a tremendous amount of money, a tremendous amount of resources. So reaching out and getting this partnership, they have an expertise in the putting together this type of program, and the peers program, peer support individuals, and the counselors and what have you that we just not necessarily have here at the Sheriff's Office. And they bring that to the table, and we can bring that before our inmates and hopefully break the cycle.
Well, Veronica, talk about those team members who work together with the sheriff's staff here, the detention officer that works here. You all have brought in a team to work together. Talk about who those folks are.
So we work very closely with the detention center staff, the jail leadership, and so what we've brought into the jail are a case manager who assesses individuals and identifies their need, and then begins to make referrals to community-based service providers. One of the things that we understand is that case management truly begins when they are released, because that's when we try to connect them to services. We have a peer support who is someone that they can identify with, and typically the peer support is the person that these individuals trust the most. They're willing to share the most information, and that information really helps us to tailor their case plan and services. And we have a therapist who provides substance use counseling, and she does all evidence-based treatment for them. And then we have a dedicated detention officer who moves these individuals and then ensures safety, ensures that, you know, these individuals come to and from the blocks, and has been a great resource for us.
And so in that case, it is truly a partnership. It is, you know,
Absolutely.
From the need, not just within the detention center itself here, but within the community, and the role that you all play at CHS in trying to help just break this cycle of opioid use and substance use in our community, and which we've seen again is epidemic. How long has the program been effective or in place? How long have you all been working together on this?
2000.
It began in 2022.
Okay.
And it was on a very small scale.
Okay.
And right at the beginning of COVID.
Right. So here we were in the midst of a worldwide pandemic, where we've got other restrictions in place and other concerns and other stressors on all of our resources. And so really in 2022, you sort of began slowly, and now typically how many folks do you have enrolled within treatment during a time period?
It averages at 20.
About 20 folks. So
and that number goes up regularly, but it stays at 20. We have not seen the number decrease below 20 in the past couple months.
Now, and we're looking at this solidly working, you know, gradually ticking up in involvement in the community over 2 years. What has been the response? What are you seeing? What are some of the outcomes that you've witnessed?
I have been a little surprised at the willingness of some of the inmates to get into the program, especially the counseling part. I was really surprised with that, because I thought they would be a bit standoffish. But the individuals they have doing it, and the dedicated detention officers that's with them on a regular basis, I think the trust and actually their hope maybe of getting to a better spot has been surprising to me. It's actually nice to see. So.
That's what I was going to say. This element of trust. I mean, I sense it in the conversation with you two as well, that this is something you're both so committed to and something the county is committed to. Veronica, talk about that relationship building and why that's been so key to the success of the program.
So relationship building was very important, and the relationship building started with just the staff of the detention center and the sheriff's office itself, and then we identified that we really needed to make a concerted effort to build a relationship, or at least establish some sort of trust with the inmates themselves. And so what we did is we have made a very big effort to even just greet them, hello, learn their names. And they get very surprised by the fact that we greet them by name. That means a lot. And I try to remember things about them. We all do on the team, try to remember something about them, ask them something about their lives outside of this facility. And then when we knew that the therapist had been hired and that she would be starting, we started to lay the foundation for therapy is coming. You're going to meet your therapist. The therapist came and met with them several times, very casually, before the group therapy kicked off. And they were very excited, and it got to the point where they kept asking us, well, when is therapy starting? Yeah. And I can tell you that in the community, just this week, I was told, I don't know what you guys are doing or what Sheriff Thomas has going on at the jail, but we can tell that something good is happening there, because some of the individuals who have been released and are now obtaining services through community-based service providers have talked about the difference and the services that are being offered. So I'm hearing so many things. So first and foremost, when you're here, when you've been brought to the detention facility, when you've been arrested, when this is more than likely the lowest moment in your life, and why anybody would want to help me get out of that low point, and then to find someone who can and understand that the support for that comes from two places. Comes from both the world of health care and mental health care and the world of law enforcement, that everybody's on my side to get me there, I can't think of a better testimonial than, I don't know what you're doing, but you're making a difference. Sheriff, talk about going forward. What are you looking forward to in next steps when we think about the effectiveness and the success of this program?
Well, maybe being able to expand the program where we can set more people in it. As the demand increases, we want to meet the demand. I don't want to have an individual back there that wants to try and them not have the access to it. So that to me, that's the next step, is make sure the program grows to the demand that it receives from the inmates.
And so. Victoria, what about you? As you're hearing the sheriff say that, what are you looking forward to?
I'm very excited about the opportunity to collect data on these individuals, and to understand a lot, because I think that sometimes we miss opportunities to collect data, but one thing that we are starting to do now is every individual in the program is assessed, and we are able to keep statistics on who experienced trauma, who experienced some sort of familial substance use when they were growing up, and try to really understand the root causes of why these individuals are turning to substance use so that we can better treat it. Another thing that we've come to realize in the past month or so is that because these individuals are so excited about the treatment, they are giving us the information about what they need outside of this facility. And they make suggestions to us about, can we start a support group outside of this? Are you guys willing to do a support group for us? You know, that they give us ideas, and some we may be able to implement, others, you know, may take some time, but they're excited. And so we want to make sure that we are treating the root cause of the substance use.
You know, when I think about what you've just said, we talked about what the sheriff sees as next steps, which is being able to offer the service to more. And then you talk about your role in those next steps. But what you've given these folks that you're working with and treating is you're giving them next steps. You're giving them the next opportunity so that they don't continue that cycle, Sheriff, that we talked about in the beginning. Again, I cannot thank you both enough. We want to invite you back to discuss with us how those next steps are going. Is there anything that you would share with our viewers who might be curious to know more about the program?
I would like to share one more thing.
Yes, sir.
We're also, outside of the grants, we're going to offer AA here as well. We're working with a group to bring an AA person in here at least once a month to sit down and talk with individuals. So that would be part of the next step.
Absolutely. We don't define substance abuse by just those things that are controlled substances, but also alcohol. And as you said, that is often so much the root of the beginnings of so many of the trauma that happens in people's lives. So thank you for that as well. Veronica, anything that you would share that you would want them to know about how meaningful, what are your team members saying about how they feel about the program?
Well, I have a team that's very passionate. They're fixers. They want to help in any way they can, even if it just means meeting an immediate need of communication with an inmate and letting them know, hey, we're working on your stuff. Bear with us. Don't think we forgot. And then in the grand scheme of things, we've seen things improve. I'll share very quickly a story that happened just yesterday, and that was that an inmate was released, but he had 45 days left on probation that he had to serve. And he said, well, I'll come back. I'm getting treatment, I'll come back. And when I was passing through booking, he was telling another inmate who had been booked on substance use charges, they have programs here. They have programs here. Just let them know that you need to be part of the programs. So that's a positive, and we look forward to it. So I shared that with the team, and they just get so excited, and it just motivates them to continue working so hard for these individuals.
Well, thank you. That was so important. Thank you for sharing. That is incredibly impactful. Thank you for that, Veronica. Thank you both for what you're doing.
Absolutely.
Again, this is about the individual, but this is about the community. So thank you both for what you're doing, and we look forward to hearing more about the program.
Certainly.
Thank you for having us.
Thank you.
Thank you, as always, for joining us for Onslow County today. And a very special thank you to the Honorable Chris Thomas, Sheriff of Onslow County, who has provided our set for us today. As you watch the show, you probably see the vast variety of services offered by your Onslow County. Please visit our website, follow us all on social media, and learn more about how you can explore your Onslow County today.